Okay, perfect. Thank you very much, Steve and Cindy. For our next talk, we're going to invite Valerie Tarasuk from University of Toronto Department of Nutritional Sciences to come and give us a talk. This will get us into sort of the meat and the potatoes, the emotional part of food security as well, to give you some ideas and hopefully inspire you a little bit to think of some things you may want to work on through the competition. Great, thank you.
Thank you. So, thank you for inviting me to be a part of this thing. I'm going to talk about food insecurity in Canada. And I understand that this competition is way bigger than Canada, and it's actually way bigger than the idea of food insecurity that I'm going to talk about. But given that we're here in Toronto, I thought it would be important for you to at least be oriented to the problem from this perspective. The public image of food insecurity in Canada is things like this. It's appeals for donations to food banks. We're heading into Thanksgiving weekend. You will be unlikely to go into a grocery store right now anywhere in Canada without finding bins asking you for donations to fight hunger in Canada. What you may not know is that for many, many years, we've been measuring food insecurity on national surveys. I say we, Statistics Canada has been measuring food insecurity on national population health surveys. What I'm showing you here is a summary of the 18 questions that are used to assess food insecurity in Canada and have been now since 2004. These are the same questions that are used to monitor food insecurity in the United States, and they were initially developed by USDA. I'm showing you these questions because I want you to understand what I'm talking about. The most mild question of the 18 is, do you ever worry about not having enough food because of a lack of money? Then they move progressively downward in terms of the severity of the compromise. So people relying on a few low-cost foods because they don't have money for more, not feeding themselves or their children balanced meals because of a lack of money. But the bulk of the questions are actually asking about people's experiences of quantitative food deprivation. So skipping meals, cutting the size of meals, and going hungry without eating, and ultimately not eating for whole days at a time because of a lack of food or money for food. All of the questions have this clause attached to them to establish that the deprivation is involuntary, that it is about a lack of ability to purchase food. The problem is anchored in purchasing power here because that's how most Canadians get their food. They buy it. The questions differentiate between the experiences of adults and children because of an abundance of research that shows when families are deprived of resources, adults will deprive themselves of food as a way to free up scarce resources for their children. So this is a very, very harsh measure of a problem in our country. It stands in stark contrast to the broad definition of food insecurity that is published in Canada by our government, but also that appears in FAO, WHO, UN publications. This is one variation of it. It's a kind of a motherhood statement, all people at all times having sufficient food. What we're monitoring, and certainly what my group is researching, is a very, very specific subset of that broader notion of food security, which is household food insecurity, defined as inadequate or insecure access to food because of financial constraints. This problem is monitored routinely on a survey called the Canadian Community Health Survey. It's run by Statistics Canada. It's a survey that's run annually, and its intention is to monitor the health of Canadians. It is a very large sample of 130,000 people over each 2-year cycle. It omits people living on First Nations reserves, which is quite significant for the problem of food insecurity because they're so vulnerable. Should you be tempted to go down this path in this competition, and I would dearly love it if you would be, some of these data are publicly available through the StatsCan website. Here we have 4 years of nationally representative data, and here's what they look like. Over the years that we've been systematically monitoring food insecurity using this module, the problem has gotten worse. The bars are graded to show levels of severity. The severity is determined based on the number of affirmatives. So that very bottom section, severe food insecurity, are people who answered affirmatively to enough of the 18 questions for us to believe that there was absolute food deprivation in the household. Here's what the problem looks like across the country. The prevalence This is 2012. There are more recent data for some jurisdictions, but not for all of them, which is why I'm only showing you 2012. In 2012, our lowest rate of food insecurity was in Alberta, and that was 11.5%. Nowhere in Canada do we even have a prevalence as low as 10%. The high prevalence of 45.2% is in Nunavut, and any measure that we ever have of food insecurity in Nunavut indicates a very, very tragic problem. These prevalences are presented at the level of household because food is bought and shared at the level of households, so that's our unit of analysis. But if we translate that into people, how many people are affected by this problem? Well, by our best estimate, it's more than 4 million. Families with children are overrepresented amongst the food insecure in Canada, which is a tragic statement in itself. Here you see the proportion of children living in food insecure households based on geographic region. And again, you can see the appalling story of food insecurity in Nunavut. Almost 2 in 3 children there are in food insecure households. Overall, we're talking 1 in 6. So this is a very, very widespread problem. How does it compare to food banks? I started this by telling you that they are the public face of the problem. That yes, they are still the public face of the problem and a very prominent face, but in fact, food bank numbers grossly underestimate the extent and magnitude of the problem. Fewer than 1 in 5 Canadians who are food insecure will set foot in a food bank, and we have absolutely no evidence that anybody who does will be rendered food secure by the experience. What is driving the problem of food insecurity in Canada? Well, nothing to do with food. That's what we can figure out so far. This pie graph, despite the negative billing they had in the earlier presentation, here you see food skills. This is a measure of food skills that was included on a wave of the Canadian Community Health Survey. So here we're looking at the food skills of adults based on household food insecurity status, and there is no difference. When we look at food retail access, nutrition knowledge, food shopping behaviors, there's nothing that we can see that indicates that food insecurity in Canada is a food problem. It is very, very tightly related to income. The lower the income, the higher the probability that someone will report food insecurity. And that makes total sense when you think about it. We buy food. We're measuring here a problem of inadequate or insecure access to food because of financial constraints. Who's most likely to have that? People with a lack of money. But you must also have already noticed from this graph that the relationship between food insecurity and income is imperfect. We have to go a very long way along the income spectrum before we hit 0. And we never hit 100%. We can find households with very low incomes, as reported on a StatsCan survey, at least for a 12-month period, who look like they shouldn't have enough money to manage, and yet they do. Well, we and others have spent a long time pondering this problem, and what we have come to conclude is that the reason there is such a profound, such an imperfect relationship between food insecurity and income is because food insecurity is actually a better measure of deprivation than income is. By the time we capture a household that is struggling to put food on the table, what we're seeing is the product of income, assets, and expenses. And our look at income is not just the cash flow into that household over the course of the 12-month period, but it's also the stability and the security of that cash flow. On top of that, assets are critical to buffering income shocks. And a big part of why we find food insecurity amongst higher income households is income shock. Somebody loses their job. Something happens that is an increase in expenditures that a household without assets can't manage. On top of that, obviously, there's this issue of the relationship between the income and the cost of living in the area. So we identify food deprivation or food insecurity through the lens of food. But one of the other things we've come to understand is that wasn't me. By the time a household reports food insecurity of a magnitude that gets captured on this module, they're not just struggling to feed themselves and their kids. They're very, very likely to not be paying bills, to possibly be behind in rent, if they have prescription medications with any cost associated with them, they're very likely not to be filling those prescriptions. They're not doing a whole bunch of things that we would think of as good, healthy behaviors. So we find the deprivation through the lens of food, but what we're actually capturing is a more complex set of basic needs, basic goods and services that are being compromised in this context. That's important also when thinking about the solutions to this problem, because it's part of the explanation for why we can't solve this problem by simply tinkering with the food component. It matters that we figure out how to address this problem because it is very, very tightly tied to negative health outcomes. The more research we do in this area, the more heartbreaking it is that across the life cycle, just about any health measure we look at is more prevalent amongst people living in households that are food insecure. Yes, we find diet-related problems. So diet-related diseases like diabetes are more prevalent amongst food insecure Canadians. But that's just scratching the surface. We also see very, very strong relationships between mental health disorders and a whole range of other chronic conditions. The other thing that we can see very clearly is that people in households that are struggling to put food on the table are not able to manage any chronic condition they have. So they're more likely to show up as having complications to those conditions. Another way to look at that is this. This is work we did a couple of years ago using health administrative data from the province of Ontario, looking at the healthcare costs of people who are food insecure. Adults who are based on their household food insecurity status over a 12-month period. And what you can see here is a very, very clear gradient. The more severe the food insecurity, the higher the healthcare cost that that person acquires through a 12-month period. If we do more complex analysis of this, taking into account income, education, other variables that have been known to associate with health and with healthcare utilization, we don't wipe out the effect. Food insecurity has a strong, independent, predictive effect on health and healthcare spending that is independent of other social determinants of health. What is effective at reducing food insecurity? Well, we have a limited window into this because nobody's tried very hard so far in this country to reduce this problem. But here's what we know so far. Here you see data from 2012 again, looking at the rates of food insecurity based on main source of income in the household. And you can see, again, a very profound gradient whereby those who reported the main source of income to be a senior's income, so a pension or retirement income, have a very low rate of food insecurity. At the top end of that spectrum, we can see people on social assistance. There's been a lot of work done by our colleagues at the University of Calgary and now the University of New Brunswick, Lynn McIntyre and Herb Emery, to try to understand why it is that we consistently see very low rates of food insecurity among seniors in Canada. And what they figured out is that this has a lot to do with the guaranteed annual incomes that we provide seniors, when they turn 65. They get a public pension, full drug benefits, but that pension is effectively an income floor. Here's a more complex analysis that they did, looking at Canadian adults, low-income Canadian adults, unattached adults, so that this wasn't confounded by the presence of a spouse. They looked at food insecurity rates over time as people aged towards 65 and then turned 65. And look what happens at the point that they turn 65. The rate of food insecurity in this group that are very vulnerable by virtue of their low incomes, the rate of food insecurity drops by more than half. Nothing has changed in those people's lives except that they had a birthday. But what a birthday, right? That birthday now qualifies them for income that is more than twice the income that someone in most parts of Canada would be receiving if they were on welfare. And much higher than the incomes of many people who are tenuously attached to the labor force. The other piece of insight that we've been able to glean by looking at food insecurity in relationship to income source comes from the other end of the spectrum, people on social assistance. What you can see is an extremely high rate of food insecurity amongst people who report their main source of income as social assistance. That's true across the country. In some parts of this country, more than 80% of people who are reporting main source of income as social assistance are food insecure. What's also very, very troubling for us is the very high rate of severe food insecurity amongst people on social assistance. As you can see in that bar, almost half of them report severe levels of deprivation. Okay. Over and over again, people have done costing, people in public health nutrition in particular, have done costing to look at the adequacy of social assistance rates relative to costs of living. Here you see an infographic produced by the public health unit in, I believe this is Parry Sound, North Bay. And so and if you go on the internet, you can find dozens of these kinds of representations. What they're doing is contrasting the money that an individual or a family on Ontario Works, which is bizarrely the name for welfare in Ontario, they're contrasting that income with costs of shelter and food, very meager costs of shelter and food that they calculate each year. And they're showing very transparently that there's no way that those incomes are sufficient to meet basic needs. So putting forward another piece of evidence to suggest that the reason there are such high rates of food insecurity amongst people on social assistance is in part at least because of the design of those programs. Our other piece of evidence that that's what's going on comes from what, from our vantage point, is a natural experiment that played out in Newfoundland and Labrador. Here you're seeing the rate of food insecurity amongst people reporting any receipt of income from social assistance in that province over a period of 6 years. And you can see it steadily drops. In 2007, Newfoundland and Labrador don't look that different than other provinces in Canada, with a rate of 60% of people with some cash flow from social assistance being food insecure. But by the end of the period of observation here, they've dropped to 34%. What's happened? Well, a lot. In 2006, Newfoundland and Labrador introduced a poverty reduction strategy. But that poverty reduction strategy, from our vantage point, was unlike any poverty reduction strategy that Canada has seen before or since. In 2006, when this thing started to roll out, Newfoundland and Labrador had a premier called Danny Williams. And he was a very colorful character in Canadian politics. He campaigned and he spoke passionately about wanting to help Newfoundlanders. He talked about turning them from a province of have-nots to haves. And one of the things that happened in the poverty reduction strategy in Newfoundland and Labrador that sadly has not happened anywhere else is part of the strategy was to deal with the depth of poverty. So people on the very bottom of the income spectrum. So a number of measures were introduced over this period to improve the lot of people on social assistance, inarguably the people at the bottom end of the income spectrum in Newfoundland and Labrador. What did they do? Well, they started by increasing welfare incomes, increasing the rate. Then they indexed it to inflation, which is very, very important over this period because this is a period of very, very high food price inflation, among other things. So increase the income checks, index them to inflation. Then they did a number of other changes related to lifting the asset limit for people coming on to social assistance so they didn't have to liquidate absolutely every speck of asset they had before they qualified. If they got work, they enabled them to keep more of the income from employment before it was clawed back. They raised the low income tax threshold, again, enabling people to keep more money. By anybody's measure, the people on this graph are still poor. Their incomes fall well below any low-income measure that Canada has. But what you can see is they're way more able to feed themselves and their children. So it's a success story. Okay, but I would be remiss if all I talked about was seniors' incomes and social assistance. So those are important programs for us as researchers to look at because they're public programs, they're public policies, right? But it only takes us part way in terms of even identifying directions for the solution to food insecurity in Canada. And that's because most of the households that are food insecure are not on social assistance and they're not receiving seniors' benefits. They're in the workforce. And what you're seeing here is the proportion of food insecure households by province and territory who are reliant on employment incomes. The lowest number on this graph is Ontario at 58.3%. And look how high it gets when we get to Prince Edward Island. So tackling this problem means finding a solution that actually reaches people in the workforce. Now, why is it that somebody would be working and still saying yes to any of those 18 questions? Well, we have a limited window into this with the Canadian Community Health Survey data that are at our disposal, but here's what's been figured out so far. Obviously, these are people more likely to be in low-wage jobs, but they're also part of this growing cadre of precarious workers, right? People who have short-term, part-time, contingent work, so not steady incomes that are dependable and come with benefits. We also find food insecurity more prominent amongst households where there is one person or a couple of people working part-time, but their income's being used to feed the mouths of a whole bunch of other people, right? A family of 5 or 4, but only one person in the workforce, maybe in a low-wage job. Part of the way that people in low-wage jobs stay out of measures like food insecurity is by having multiple incomes coming in. But as the economy shifts and we move more and more towards this very divided society in terms of employment opportunities, we've got a real problem on our hands with people attached to the workforce but still unable to make ends meet. But it's not enough just to talk about the design of work. We also need to think about social policies that actually have the potential to mitigate issues of low wage or limited employment. And part of, I think, what we're seeing with the very high rate of working people in the ranks of food insecure in Canada is the failure of our income transfer programs to mitigate things. So we have transfers like the Canada Child Benefit, for example, that should be or could be, and perhaps in some ways are designed to offset the low-income households' situations by providing another source of revenue. But somehow these income transfers haven't been balanced with actual needs, I think, which is why we're seeing this very significant problem amongst people in the workforce. Okay, so to summarize, I hope I have persuaded you that food insecurity is a serious problem in this country, and that when we identify someone who's food insecure, we're identifying someone who's experiencing material deprivation across a broad spectrum of essential goods and services. Food insecurity is also a very, very significant public health problem in Canada and a substantial contributor to higher healthcare costs and a modifiable risk in terms of healthcare costs. To date, the only interventions that we have found that appear to be at all viable in terms of moving the needle on this problem are policy interventions that have actually gotten to households that are vulnerable to food insecurity by virtue of their low incomes and somehow moderated that vulnerability. Okay, lastly, a word from my sponsor. If you are at all intrigued by this talk, please take a look at our website. I am the lead investigator for a research group called Proof that is funded by the Canadian Institutes of Health Research. And we do our darndest to popularize the statistics and the research on food insecurity to try to draw more attention to what we believe is a very significant problem. Thank you for your attention.
We have some time for questions if anybody has any. Not yet. Okay, great. Thank you very much, Valerie. Okay, we're actually, I just left my phone, so I don't know exact time, but this is time for a break, so we're going to take 15 minutes. Hopefully, Valerie's talk sort of filled your mind with interesting things, and I'm making a huge assumption here, but if Canada has these issues of food security, my guess is that there's countries around the world with very similar situations. So, and on top of that, we also heard about some potential great databases or data sets from Statistics Canada and Toronto and that kind of stuff too. So some ideas for you to think about for the challenge. So we'll give you 15 minutes. Sorry, I don't know what time it is right at the moment, but 15 minutes we'll start back and Megan Miller from McGill will come and talk at that time. Okay, thank you.